Assalamu alaikum. My name is Mohamed Mohideen. I'm the president of the Islamic Council of Victoria. I'm here with the brothers and sisters of the community to talk to you about coronavirus, COVID 19, and what you can do to keep yourself, your family, and your community safe. Our faith teaches us the sanctity of life is paramount, and as such, we need to consider the teachings of our beloved Prophet and keep our community safe at all times. COVID 19 is a highly infectious disease which causes respiratory infections. The symptoms are very similar to that of the flu, but caused by a different virus, and is mostly spread by people coughing and sneezing. People may also pick up the virus from surfaces contaminated by a person with the infection. As a microbiologist, I know that the COVID pandemic is not over yet. It'll be many months or even 2021 before we can go back to a normal way of living. Here in Victoria, the number of cases have doubled in the last week, and the areas we live in are being affected. The virus can attack younger and older adults. We are all at risk. 1 in 10 people are so sick that they may need to go to hospital and may also need ventilating. 1 in 100 may die of this disease. Across the world, 500,000 people have already died, and there will be many more deaths to come.
Coronavirus, or COVID-19, is highly infectious. It is spread by coughing, sneezing, and touching contaminated surfaces. The pandemic is not over yet. It may continue well into 2021. It can attack younger and older adults. 1 in 10 people have to go to hospital.
So we need to take care of our own health as well as our family's health. It is important to get tested for coronavirus and encourage our family members and loved ones to get tested if we display any of the following symptoms: fevers, chills or sweats, cough or a sore throat, runny nose or sneezing, shortness of breath, loss of sense of smell or taste, or any other unexplained symptoms like diarrhea or feeling exhausted. Even if the symptoms are mild, go and get tested. And if you are unsure, contact your family doctor or your community health service for more advice. Testing is free at your public health facilities, mobile testing centres, and GPs offering bulk billing. Just take your Medicare card or any other form of ID with you. The test is pretty straightforward and it takes about 1 minute. I recently had a test after displaying some of the symptoms, and I got my results back pretty quickly. Fortunately, they were negative. There is a public testing site near you. You can find these details through your local mosques or contact the Victorian Government's Coronavirus 1-800 hotline. And please remember, after testing, it is vitally important that you stay at home until you receive your results.
If you have symptoms, get tested. Call your doctor or community health service for advice. There is a testing site near you. Stay home until you get your results. Call 1-800-675-398 for more details.
The best way to beat coronavirus is to avoid it by following the health advice given by the health experts, not by the non-qualified people on the internet. This means practicing good hygiene, avoiding crowds, and maintaining social distancing by keeping 1.5 meters between each other. This also includes family members we don't live with and friends. No more than 5 people, including babies, should visit your home at any one time. Outside the home, people can meet in groups up to 10, while keeping the social distancing by keeping 1.5 meters between each other as well. Mosques can have maximum of 20 people in any one space, and while keeping social distancing between each other as well. This is the same rule for community halls, libraries, museums, and restaurants. Visitors to the home must do the following: washing their hands upon arrival and during the visit. Using water and soap is fine, and also using hand sanitizers with at least 70% of alcohol is also good. Stay arm's length apart 1.5 meters. Don't hug, kiss, and shake hands. Don't share food and drinks.
Follow the advice of health experts. Practice good hygiene. Wash hands, sneeze and cough into your elbow. Avoid crowds. Keep your distance from others, more than 1.5 meters.
Hi, my name is Maha. I'm a Sergeant Victoria Police. If you can work from home, you must stay at home. Staying at home will keep people like me and other essential workers such as nurses and doctors safe because we cannot work from home and we're out there to keep you safe. If you're unwell, you should not go to work or to the mosque or any other places of worship or even visit a friend's house because you may be carrying the virus and spreading it around. Coronavirus or COVID-19 spreads very quickly. Just one person can start an outbreak and it will be out of control. Although there are laws and fines in place, it is much better to do the right thing from the start. Please do not try to bend or break the rules. It could end up with you or a member of your family really sick or a fine.
If you can work from home, you must work from home. If you are unwell, do not go out. There are laws and fines. Don't break the rules.
For casual workers, it can be hard to stay at home if you're unwell and if you do not have paid sick leave. That's why the Department of Health and Human Services is providing a one-off payment of $1,500 for those Victorian workers who have been instructed to isolate at home. Free emergency food relief is also available to those who have been instructed to stay at home. You can ask the Department of Health and Human Services for more information and eligibility criteria for both these schemes. As community leaders, we have a role to play in informing our community. We could do so by telephoning, by email, by social media, and other networks as well. But at the end of the day, it'll be each one of us that can make the difference.
There is a one-off payment of $1,500 available for casual workers who have to stay home. There is also free emergency food relief. See the Department of Health and Human Services for more details. Help keep the community informed.
So along with you, my brothers and sisters, I would urge you to practice physical distancing, testing, and staying at home when necessary. I know it's hard on every one of us, so call people and check on how they are coping. Together we can keep our community safe. May Allah subhanahu wa ta'ala remove this disease from all mankind and keep our community safe. And inshallah, we will be able to get back to our mosque very soon. Assalamu alaikum wa rahmatullahi wa barakatuh.